Namaste. Myself, Dr. Neetu Vijith, Director and Women Wellness Expert of Dr. K.V. Vijayan Institute of Ayurveda Medical Science Private Limited. I am deeply honored to extend a warm welcome to each of you who have taken the time to join us today. Whether you are a person living with Parkinson's disease, a caregiver, a healthcare professional, or simply someone interested in learning more about this condition, your presence here is incredibly valued. On behalf of VIAMS, I offer my regards to all who have joined with us. Today's webinar has been designed to introduce harnessing Ayurveda's potency for Parkinson's relief, VIAMS revolutionary approach. We are conducting this webinar on behalf of World Parkinson's Day. Parkinson's Disease Awareness Month is observed annually in April to raise awareness about Parkinson's disease. During this month, efforts are made to educate the public about the symptoms, treatments, and challenges faced by individuals living with Parkinson's disease. Before introducing the speaker, a few words about our hospital. Dr. K.V. Vijayan Institute of Ayurveda Medical Science Private Limited, shortly VIAMS, where traditional wisdom meets cutting-edge neuroscience. VIAMS is not just a healthcare institution. It is a sanctuary of holistic healing rooted in the timeless principles of Ayurveda. Nestled in the heart of Medathur, Palakkad district, Kerala, our hospital is dedicated to restoring balance and vitality to the lives of our patients through personalized Ayurvedic treatment and therapies. VIAM's mission is to promote health and wellness by harnessing the natural healing power of Ayurveda. We are committed to providing compassionate care and empowering our patients to achieve optimal neurological health and well-being. We continuously strive to innovate and advance the field of Ayurvedic neurology through research and development. We at VIAMS essentially focus on neurodegenerative conditions, especially Parkinson's disease, and we furthermore broaden our expertise in infertility, women wellness, spine and joint care, lifestyle disorders, and skincare. VIAMS offers integrated treatment protocol which combines Ayurvedic science with physiotherapy, psychology, audiology, speech therapy, dietetics, yoga, and meditation. Our multidisciplinary team collaborates to provide comprehensive and personalized care to our patients, utilizing a combination of traditional wisdom and modern medical expertise. Today, the session Harnessing Ayurveda's Potency for Parkinson's Relief, VIAM's revolutionary approach, presenting by Dr. Vijith KV, our Chief Physician and Managing Director, expert in Ayurveda, Neurology, and Wellness. Ladies and gentlemen, please join me in extending a warm welcome to our esteemed speaker, Dr. Vijith KV, for today's webinar. He is the torch bearer of the fourth generation of noble traditional Ayurveda family, Pelladatwalapil. Dr. Vijith is a highly respected Ayurvedic neurologist with a wealth of experience in diagnosing and managing a wide range of neurodegenerative conditions such as Parkinson's disease, movement disorders, Alzheimer's disease, progressive supranuclear palsy, multiple sclerosis, different types of dystonia, dementia, etc. With extensive expertise in the field and a commitment to advancing knowledge and support for those affected by Parkinson's disease, Dr. Vijith KV is here to share valuable insights and guidance. Let's give a warm virtual welcome to him. Kindly use the chat box to submit your questions. Thank you.
Good evening, all. Most of us are very familiar faces for me. So thank you for joining today's session. So today, April 11th, is considered as the world Parkinson's. Uh, Dear all, kindly mute your mic, and after the session, we will unmute the mic and start the discussions. Thank you for understanding. So, April 11th is considered as the World Parkinson's Day every year, and today's session is regarding with the harnessing Ayurveda's potency for Parkinson's relief, our revolutionary approach. So, let's start with what's Parkinson's disease. Parkinson's disease is a progressive neurological disorder that mainly affecting the movement. It develops gradually, usually starting with a slight tremor in one hand, and can eventually leads to stiffness, slowness of movement, and difficulty with balance and coordination. So, VIAMS conception of Parkinson's disease as Kambavada. Some of you may be surprised what is Kambavada. It's a Sanskrit word meaning Kamba means tremors and Vada means neurological problems. So, this Parkinson's disease in modern science is correlated as Kambavada in Ayurveda. According to Ayurveda, the human body is composed of various elements and energies that interact to maintain the health and well being. Ayurveda describes the body as a microcosm of the universe with its own unique constitution and balance of energies. The fundamental principles of Ayurveda revolve around the concept of five elements are the Pancha Mahabhutas, the ether, air, fire, water, and earth. These Pancha Mahabhutas elements combine to form three doshas, that is, three doshas mentioned in Ayurveda, that is Vata, Pitta, and Kapha. They are known as the biological energies. So each dosha represents a combination of two elements and governs different physiological functions in the body. So the Vada dosha, the first dosha, is the entity concerned mainly with the control and coordination of our body by maintaining all kinds of movements and thought processes. So, aggravation of certain qualities of Vada presents as tremors, imbalance, cognitive impairment, etc. Thus, correlate Parkinson's disease to such an exaggerated condition of Vada called Kambavada. Now, let's see how Kambavada is mentioned in Ayurvedic text. In Dasavarajyam, that is an Ayurvedic text, it's mentioned as Karapada Tale Kambe, Deha Brahmana Dukkide, Nidrabango Madikshina, Kambavadasya Lakshanam. It's a Sanskrit sloga that means shivering of palm and soul, vertigo, severe grief, loss of sleep, reduced confidence are the symptoms of Kambhavada. And this Kamba, the Parkinson disease notations are mentioned in several Ayurveda Samhitas like Vepatu. Vepatu is also known as tremor that has been mentioned in Rigveda itself. And it's also mentioned in Charaka Samhita, Susruta Samhita, Ashtanga Hridaya, Ashtanga Sangraha, Madhava Nidanam, Harida Samhita, Vaishajyaratnavali, Sharangadara Samhita, etc. etc. So now let's see how Parkinson's disease occurs. Well, Parkinson's disease occurs due to the degeneration of the dopamine producing nerve cells in a specific region of the brain called substantia nigra. Substantia nigra is a very small part in the human brain. And dopamine is a neurotransmitter that plays a crucial role in regulating the movement and coordination of human body. Shall I ask you, are we are at risk? We, in the sense, the people who are living with Parkinson's disease and people who are living not Parkinson's disease. So approximately 1% of the people above 60 years of the age globally suffer with Parkinson's disease. Incidence doubles by the age of neurodegenerative disorders. Actually, this is a statistical report which has been published by the WHO in the year 2019, and now we are in 2024. So this is a report mentioning 5 years before. 5 years before. This is the second largest cause of neurodegenerative disorders. And recent observations shows growing number of younger people, that means younger in the sense younger than 50 years of age, are being diagnosed with this Parkinson disease, which comes around 8 million of global population. 5% of the cases characterized by earlier age of onset, and they are known as YOPD or young onset Parkinson's disease, even though we can control Parkinson's disease. So let's before going to the causes of the Parkinson disease. So what would be the nidana? Nidana means the reason of the causes of Kampavada as per Ayurveda. As per Ayurveda, affecting Uttamanga, that means Abhyantara Marma Abhigada. We may be familiar of Marma, that is the vital points in different parts of the body. So a Marma Abhigada, that means a trauma on that vital part, that may affect Parkinson's disease. Then Mityahara Viharas, that means the improper food habits and lifestyle habits may leads to Parkinson's disease. Concept of Dushi Visha, that is the pesticides, preservatives, coloring agents in the foods and the drugs what we are consuming for other diseases, that may also leads to Parkinson's disease. And Janapadodam, so the pandemic and epidemic diseases we gone through recently, the COVID-19, the coronavirus, that also may lead to different types of vascular diseases, especially vascular dementias in the last 1 or 2 years of time. And definitely hereditary factors. If the parents or the grandparents or the siblings or the uncle from the mother's side who is having any type of neurological or neurodegenerative or neuropsychiatric diseases like Parkinson's disease, Alzheimer's, dementia, mentally retarded, stroke, paralysis, epilepsy, they had the chances of having one or other types of Parkinson's disease compared to other. And drug induced, those who taken medicines for epilepsy or any chest related problems or our gut problems or skin problems, they may also have the chance of having this Parkinson's disease. And traumatic, if you're having a road traffic accident or a head injury or hitting the head on a hard surface, we may heard about we all of may heard about Muhammad Ali, the international boxer. He had been suffering with this Parkinson's disease because he had received so many hits on the head on his professional life. So the traumatic is one of the main major cause of the Parkinson's disease. The chemical interactions I had already mentioned, and the environmental factors. Environmental factors in the sense, suppose if you are living in a polluted area, maybe we will be having a hard water, we will be having a very bad weather. So the environmental factors, long term of exposure to that environmental factors may result in Parkinson's disease. And definitely the hormonal imbalances nowadays. Generally, we go and check the T3, T4, TSH because there are some other hormonal disorders such as like thyroid dysfunction or hormone fluctuations during the menopausal stage. Then if you are going for a heart surgery or a angioplasty and any other neuronal communication, these contribute symptoms like mood swings, cognitive difficulties or memory problems. These also may lead to the cause of the Parkinson's disease. And various factors like modern lifestyles, genetic factors, alcoholism and drug abuse, these may also lead to Parkinson's disease. Now, Let's discuss about the signs and symptoms of the Parkinson's disease. So we can uh, mainly classify the signs and symptoms into motor symptom and the non-motor symptoms. So the motor symptoms is mainly related to any movements in our body, and the non-motor symptoms include the cognitive and sensory functions, those who are related to conscious intellectual activities such as cognitive functions, such as those who are related to conscious intellectual activities such as thinking, remembering, or reasoning, and sensory, that is purely related to sensation, that is conveying the nerve impulses from the sense organ to the nerves, and this especially the panchendriyas, the eye, the nose, the tongue, the skin, and ear. So what are the motor symptoms of generally we can see in a Parkinson's disease patient? So the cardinal symptoms of the Parkinson's disease is known as TRAP, T-R-A-P. T represent for tremor, and tremors are different types of tremors are there. Rest tremor. Suppose if you're reading a newspaper, or suppose if you're watching a TV, or suppose if you're doing some other activities, if you're simply sitting in a sofa or a chair, if we have tremors in our hands, then it is known as rest tremor. And the second is the kinetic tremor. That means that patient, the person with Parkinson disease, will not be having any tremors on the hand, and suppose he is going to take a gadget, or he is taking to go to take a pen, or taking a cup of coffee or tea, suddenly the tremors start, and that is known as the kinetic tremors. And pill rolling tremors, like pill rolling tremors in both the hands. And coming to the R, it is known as rigidity and stiffness. This is one of the most complaint, like a painful complaint, people with the Parkinson disease are complaining. That means when they may be having severe stiffness and rigidity in the shoulder muscles, or thigh muscles, or calf muscles, or lumbar muscles, like severe spasm and rigidity will be there, and this is actually restricting their movement for the walking or running or something like that. And coming to the third one, the echinacea or the bradykinesia. Echinacea means freezing of our gait in the sense freezing of our walking. And bradykinesia means, if suppose if you're walking in a veranda or walking in a straight surface, gradually the speed of our walking will get reduced, and it is known as bradykinesia. And the fourth one is postural instability. That means, suppose if the patient is standing for a few minutes, for a 3 or 5 minutes of time, if the patient is having a typical Parkinson disease, the shoulder will bend to forward, and the patient will be having difficulty to lock the knee. So suppose a patient without locking the knee, and bending the shoulder to the forwards, and stiffness in the hands and the legs. So that is known as a typical Parkinson's postural instability. And there are some other motor symptoms which includes micrographia. Micrographia means smaller handwriting. Handwriting becomes very small, and signature will be very difficult. And masked face is one of the another. That means there will not be any expressions in the face of the people with Parkinson's. No smiling or no other like emotions will be there in the face. And dystonic movements or dystonia. Dystonia means abnormal muscle movement. There are different types of dystonias, like cervical dystonia, oromandibular dystonia, focal dystonia, musician's dystonia. Different types of dystonias are there. And dysphagia and dysarthria. Dysphagia means difficulty to swallow the food, especially volume items like tea, coffee, juice, water. That if they suppose if they're swallowing the volume items, a choking will be there, a cough will be there. And dysarthria. Suppose if the patient is talking with the family members, or talking with the friends or the relatives, or a gathering, or somebody is working, or somebody is like a tutor, if they want to express some points definitely in that meeting, they will forget that a few of the points, and they will be remembering after 1 or 2 days of, oh, I didn't mention that point. That is known as dysarthria. And a monotonous soft voice, and the absence of arm swing while walking. This may be one of the primary symptom some patients may be facing. That means if they're walking in a normal speed and everything, hand will not swing. So the family members or the close relatives may watch about that and ask why you are not moving your hands during walking, and that may leads to go and consult a neurologist or a doctor. So absence of amsling is one of the primary motor symptoms seen in the Parkinson's disease patient, and excessive drooling from the mouth, and muscle cramps, dressing difficulties, buttoning, shirt buttoning, slipping chappals, difficulty to wear the chappals, bed rolling, aches and pains, severe fatigue are the other motor symptoms seen in Parkinson's disease patient. Now, coming to the non-motor symptoms, that is the cognitive symptoms, we can say is depression, sleep disturbances, fearful dreams, hallucinations, psychosis, apathy, anxiety. These are some of the generic cognitive symptoms. And sleep disturbances, in the sense, the patient may have difficulty to sleep, to start the sleep. Some of them may have difficulty to start the sleep. Some of them may wake up after 2 hours of the 2 hours of sleep, and some of them will not get a proper sleep, and fearful dreams, like somebody is going to attack the patient, somebody is some accidents they may be seeing in their dreams. These are the fearful dreams. And hallucination mean unclear voices or unclear talks during their sleep, and sudden waking from the sleep. Then excessive daytime somnolence, sleep disordered breathing, some sleep apneas, then long and hard noises during the sleep, then confusions to take the decision. These are some of the cognitive impairments seen generally in the Parkinson's disease patients. Now, coming to the non-motor symptoms, sensory symptoms, you may be heard about the panchendriyas, the eye, the ear, the nose, the tongue, and the skin. So, the imaginary vision, that means if the patient is simply sitting in the home or the office, they feel that somebody is hiding behind that curtain, or actually, if it will be a chair, they suppose that somebody is standing there or sitting there. That is known as imaginary vision. And hearing unusual voices, and can't recognize proper smell, can't recognize like improper taste. That means your sense of the taste is not functioning properly. Hypogeusia, that is reduced ability to taste an imaginary smell, or anosmia, that is the complete loss of smell. And hyposmia is known as the reduced ability of the smell. And coming to the touch, before coming to the touch, pain, pressure, sensitivity, and dysesthesia, that is abnormal sensation, will be there in the touch sensory symptoms. So, and other symptoms, overall symptoms seen in Parkinson's disease are urinary incontinence. That means difficulty to pass the urine, or urgency to pass the urine. That is known as urinary incontinence. Then the hypotension is one of the general sign and symptom seen in Parkinson's disease. Some sexual problems, both in the male and the females, may be seen. Constipation, one of the basic symptom, one of the very starting, even 10 years before, the constipation may start, and that constipation may end with the Parkinson's disease. But the people with constipation all will not be suffer with Parkinson's. Don't misunderstand me that. But constipation is one of the basic symptom of Parkinson's disease. Then fatigue, frequent falls because of the imbalance during walking, aspiration, bruxism, weight loss, and weight gain. Weight gain, like if the patient is taking some hormonal medicines, there are chances of the weight gain also. And now I had mentioned about the signs and symptoms, the causes, the motor symptoms, not motor symptoms, everything. Now, what is the objective of our institution? Our objective is to arrest the further degeneration of the brain cells. I mentioned that this is a progressive degenerative neuromuscular disorder. So we have to arrest the further degeneration, and we have to slow down the progression of the disease. That will be the primary objective. Secondary objective, if we win in the primary objective, the secondary objective will be betterment of the quality of the life. That means If somebody is driving a car, they will not be able to drive the car because of this Parkinson disease. If somebody is having a job, if somebody is involved in a profession, he or she may be not able to go the office or something like that because of this Parkinson disease. Or some people may not be able to do the household activities. So we can improve the quality of the life only if we can arrest the further degeneration and control the progression of the disease. And if we succeeded in these two things, definitely we can improve the longevity. Longevity means by providing a better health, the patient, he or she may extend the lifespan with good quality of life. And regeneration of cells, in possible cases, what I'm going to say is, if once a neurodegeneration has been happened, it is very difficult to regenerate the cells. And if the neurodegeneration is completed, then it is very difficult to regenerate. But if the patient is below 40 years of age, or very young age, there are chances of getting regenerate the cells of the brain. And what's our approach? We can control or stop the progression of the disease by arresting further degeneration of the brain cells with customized Ayurvedic medicines. Why I am mentioning customized Ayurvedic medicines? That means I am not purchasing any medicine from the open market. I am not giving to my patient. I am preparing the customized medicines in my own pharmacy. So some points have to assure because of this. I see the quality of the medicines, the ingredients of the medicines. These two things I have to assure, and I'm aware that what the medicine what I'm giving, and I assure the quality of those medicines. And second, with the Ayurvedic therapies and Panchakarma treatment, that is the traditional Ayurvedic treatments what we are doing, like Shirodhara, then Panchakarma treatment like Vamanam, Virejanam, Vasti, Nasyam, Dektamoksham, different types of therapies are done. And Ayurvedic therapies contribute by stimulating muscular system, thus improving both fine and gross motor skills of the patient. See, I already mentioned that the Parkinson patient will be having motor difficulties, and the motor functions are mainly of two, that is known as fine motor movements, that the handwriting signature or drawing a picture, something like that, and gross motor movement like or walking and turning, that is known as gross motor movement. So if we do this Ayurvedic therapies, definitely the fine motor movement and gross motor movement will improve, and thus slowing down further degeneration and providing the quality of the life. Now, what is the uniqueness of VIAMS treatment? I had already shared that, discussed about the authentic customized medicines. See, I can see if a patient wants a new medicine which is not available with me or not available with the market. I will prepare those medicine, or I will customize two or three generic Ayurvedic combinations and make a new combination and give it to the patient. That is not as authentic customized medicines. And coming to the personalized therapies, not same therapy I'm not providing to each and every patient. So I will consult the patient. That is the analysis and everything is coming in coming slides. So personal, if a patient is patient one, because the patient will be having with different clinical presentation like diabetes, hypertension, some surgery history, cardiac problems, or kidney problems, or even cancer problems. So so same treatment protocol will not be possible for each and every patient. So I will see the patient, I will discuss with the patient, and I will make a custom tailored personalized therapies to each and every patient. And integration, that is one of the most important and successful thing in the uniqueness of the VIAMS treatment. We do integrate with the allied healthcare techniques, whatever possible, like even if it is physiotherapy, psychology, counseling, audiology, speech therapy, occupational therapy, yoga, meditation, whatever it may be, we will do that allied healthcare techniques also. And for this approach that I had already mentioned, that we keep a 360-degree focus on the patients and their symptoms, which we can also manage all related conditions. That is the faultless approach and legacy, a rich and splendid healthcare tradition spanning 4 generations. And the methodology and our methodology is to analyze the patient, go for the investigations, differential diagnosis, then define a treatment protocol. So let's see in the analysis. Like as per Ayurveda, Trivida Pariksha. Trivida means three types of Pariksha or three types of questioning, or that is known as the Darshana Pariksha, the visual thing, the Sparshana Pariksha, the physical thing, and the Prashna Pariksha, that is the question and answers session. So, in Ayurveda, it is known as Darshana Sparshana Prashnehi Pariksheda Charoginam Rogam Nidana Pragruba Lakshano Upasayaptibi, which is visual analysis. Darshana Pariksha includes observation and inspecting a patient, the skin, the behavior, the hair, the eyes, the walking, the way he's coming to the to approach the doctor, and the physical analysis means Sparshana Parisha, physical examination such as Nadi Parisha, pulse diagnostics, palpitation, percussion, and auscultation. And Prashna Parisha, that is, this is the very important thing in the diagnosis of the Parkinson disease. That is the question and answer session. Interact with the patient, where a patient is asked about the symptom and medical history, lifestyle habits, and other important factors preceding or associated with particular health problem. And coming to the investigations, CT scan, MRI scan, uh, PET scan, liver Doppler, drug challenge, that is a Trodan scan. These are the available investigations right now. But I believe like the question, the Prashna Pariksha, the question and answer session will be very effective for diagnosing the Parkinson disease. And some blood test like CBC, electrolytes, vitamin D, vitamin B12, LFT, RFT, TFT, then ceruloplasmin, some EEG, anti-thyroid antibodies test will definitely get a good support in diagnosing the Parkinson's disease. And some red flags in the Parkinson disease diagnosis are early or prominent dementia, symmetrical signs, bulbar dysfunction purely related to the speech, early gait disorders, that is the walking difficulties, then falls within the first year, that may that is one of the MND features, the motor neuron disease features. Then if the patient is wheelchair dependent within 5 years, then we have to tell exactly what, if it is, if it was a typical Parkinson or ALS, amyotrophic lateral sclerosis, or MND, or primary lateral sclerosis. Then some cortical sensory loss. These are some of the red flags in Parkinson disease diagnosis. And always alert about the digestion, that is Samyak Agni maintenance. And Patyahara, ensure proper nutrition, sattvic diet, and ensure proper hydration. And Samyak Sugha Nidra, 8 hours sleep in well ventilated room. Abana and aniloma, that is Malamutra Visarjana. A constipated bowel is never acceptable in the people with Parkinson disease. And coming to the differential diagnosis. In differential diagnosis, we are discussing the possibilities of differential diagnosis. It includes, see, if I had mentioned that if it is a typical Parkinson disease, then the cardinal symptoms will be seen. If only once, if the patient is having only tremors in the right hand or the bilateral hands, we can't say he's having a typical Parkinson disease. See, even after 10 years or 15 years of time, he may affect with the typical Parkinson disease. But now we can mention that only it is a Parkinsonism, or Parkinson syndrome, or some other thing like that. And there is a PSP, progressive supranuclear palsy. The patient with PSP will come and tell me that, doctor, I'm having Parkinson. See, it is entirely different. In people with PSP, the eyeballs will be restricted, the mask, the face will be there, and there will be imbalance during walking only to backside, not to front or left or right. So we can easily differentially diagnose the PSP from Parkinson disease. And the dystonia, I had mentioned that there are different types of dystonia. See, if this is tremor, this is dystonia. So dystonia means abnormal muscle movements, and tremors is purely typical tremors. And OPCA, oligopontocerebellar atrophy, dementia will be there with this Parkinson disease, multiple system atrophy will be there, cerebral atrophy, cerebral atrophy. In cerebral atrophy, the patient will be having imbalance to only backside. So how we can differ the PSP with the cerebral ataxia? See, there will not be depression or anything like that. Only the imbalance to the backside will be there with the patient. And some lower limb muscular dystrophy will be there in cerebral ataxia. So that is purely related with the cerebellum, which is in the backside of the brain and associated with the spine also. And tics, chorea, these are some of the differential diagnosis we can do with the Parkinson's disease. Diagnosis. So after this differential diagnosis, whether the patient will be having the 3 or 4 cardinal symptoms, what I had mentioned before, that means uncontrolled tremors all over the body, then difficulty in the gait, that is very slow gait and imbalanced gait, and the posture, then we can say the patient is having typical Parkinson's disease. So, defining the treatment protocol. The treatment protocol is individualized as per the condition and nature of the patient and the progression of the disease. That means if people is having a Parkinson disease, that is in the young onset Parkinson disease, that means in the age of the 40, and if there is another patient at the age of 75 or 80, the same treatment protocol will not be given. See, in the age of 40, we will be given a vigorous treatment along with the panchakarma, the like physiotherapy and everything. But with the patient with the 80 years of age, we will be taking a rehabilitation mode, not a vigorous treatment will be done in that age. So that defining treatment protocol depends on each and every patient. And internal medications, those who come to me or to this institution. Initially, we will provide the internal medicines for 1 or 2 months of time that is aimed at improving the nerve and muscle strength, cognitive ability, as well as the regeneration of atrophied cells. After that only, we will move to the external therapies or the panchakarma therapies, like to improve the muscle strength, the tone and bulk, as well as improving the cognitive functions. Like the cognitive functions means Shirodhara, Takradhara, something like that. And we will advise or inform the patient the nature of the illness, the importance in maintaining good physical and mental health. Practice exercise regularly. Be active. Take diet rich in fibers and antioxidants and vitamins. Then maintain Jagrata Bala and thus Datvagni Bala. Then removing abnormal protein accumulations by limiting protein intake. That is very important in Parkinson's disease. And some blocking autoimmune triggers and avoid stress and anxiety. So now coming to the integration, and that means integration of allied healthcare centers. How this integration will be effective, or it is very effective in the treatment of Parkinson's disease. See, the integration of the physiotherapy, that means a regular exercise, can be beneficial to maintain and improve mobility, flexibility, strength, gait, and quality of life. So the aerobic exercise, balance training, gait training, weight and tools can be used to avert backward fall, flexibility training, visual tracking, gaze training using prism lens, motor cognitive exercises are done in the department of physiotherapy, and this will definitely help the patient to improve the gross motor functions. Now coming to the psychologists, clinical psychologists had a good role with the people with Parkinson disease, not only with the Parkinson disease, with the family members and the caregivers. Generally, I provide the psychology session in a 3-tier setup. That means the individual therapy to the patient, then the individual or combined therapy with the patient and the caregiver, and the individual or the combined therapy with the patient, caregiver, and the family members. So the cognitive behavioral therapy is the main therapy done by the psychologist, and he can do the psychoanalysis, humanistic therapy, mindfulness based approaches that he can do. And and he can do some behavioral therapy also, to the patient, and solution focus therapy, because this people with Parkinson disease will be very confused. So they can't take a solution, and they can't take a decision. So definitely the psychologist will have a good role in the people with Parkinson disease. And the family therapy and group therapy in the sense, nowadays Parkinson Society, Parkinson groups, there are so many groups in the WhatsApp, in the Facebook, or in the social media, had a good impact in the people with Parkinson disease. So this group therapy is also very important in the people with Parkinson disease. And these are just few examples only. Okay. Now coming to the integration of ASLP. ASLP means audiology and speech language pathology. So the ASLP specialist assesses, diagnose and treat speech, language, social communication, cognitive communication, swallowing difficulties, hearing and imbalance problems using assistive communication devices, and change the food consistency to correct the swallowing difficulty. That is dysphagia I had mentioned earlier. Because if the food getting into the lung cause aspirational pneumonia, so the ASLP specialist help to prevent this from happening, such bad things to the people with Parkinson's disease. The role of nutrition and dietetics. I had mentioned about the metabolism. So what is metabolism? The food what we are taking have to be digested properly. The digested food have to be absorbed properly. The absorbed food should be converted to energy, and the rest of the things should be excreted properly. This is the process of metabolism. So the people with neurological diseases, not only Parkinson disease, whether it is like Alzheimer's, whether it is dementia, whether it is PSP, whether it is stroke paralysis or anything, the food or whatever they are taking will not be absorbed and converted properly, and this may leads to vitamin D deficiency, vitamin B12 deficiency, hemoglobin deficiency, so many deficiencies. So if you can meet and take an assessment once in 3 months, like your nutrition and dietetics assessment should be done once in 3 months, you can correct, you can add, whether it is vegetarian or non-vegetarian diet, you can add in your diet. So definitely this will help the people with PD, and their advice can contribute to improve the PD symptom, the Parkinson disease symptoms, because this PD patients presents with gastrointestinal dysfunction leading to constipation, gastroparesis. That means food remaining in the stomach for a longer period than normal time. So this is really not good for the people with Parkinson disease. So a nutritionist have a good role in the people with Parkinson disease. Coming to the yoga and meditation, you may heard about the yoga and meditation. So like it's a mixing, or it's a blending of the body and the mind. So this yoga and meditation can improve the movement, cognitive and behavioral therapies. So yoga enhances body movements, cognitive and behavioral problems. More than being a mere exercise regimen, yoga aims to coordinate bodily functions with that of the mind. So various yoga techniques help in maintaining peace, confidence, and happiness in the mind, while helping to increase flexibility, reduce muscle spasms, and ultimately leading to an improved quality of life. So each soul is potentially divine. The goal is to manifest divinity within by controlling nature, external and internal. Do it either by work or worship, psychic control or philosophy, by one or more or all of these, and to be free. The systemic methodology of unfoldment of this inner potential divinity by moving towards self perfection is referred as yoga. So, a yoga session mainly comprises of breathing exercises, meditation, and yogasana that stretch and strengthen various muscle groups. The benefits of yoga includes flexibility of the muscles, which is really needed for the people with Parkinson's, and correct the posture and alignment of the body, renders better digestive system, strengthens internal organs, helps in skin glow, promotes strength and stamina, improves concentration, helps in mind and thought control, keeps mind calm by overcoming anxiety, stress, and depression. And yoga will helps releasing mental tension, helps in blood circulation and muscle relaxation, etc. These are the importance of the yoga. Now, the mitigation or the management. So, mitigation, that means a prevention of Parkinson disease, is really a hard thing. There is no such test to get, like if we have this Parkinson's disease after like 10 years or 20 years, there is no such. I'm not aware of that. Nowadays, a gut mapping has been introduced, and I believe that there are still some limitations in that gut mapping and everything. So, in the management, in the sense, the alleviation of exaggerated dosha, that is the concept of Ayurveda, with the customized internal medications or the formulations by cleansing the body with panchakarma therapies, that is Shodhana therapy. Then psychology counseling, nutritional assessment, ASLP, these are some of the things what we have to manage the people with the Parkinson disease. Now we are concluding our session. So, Parkinson's disease is a disorder with no established cure, and the Ayurveda has shown that it is a better success rate than other systems of medicine while dealing with any degenerative disorders. Degenerative disorders, in the sense, the osteoarthritis is another degenerative disorder. So Ayurveda treatment is very helpful in the osteoarthritis, like degenerative disorders also. Similarly, it is considerable potential in dealing with neurodegenerative disorders is yet to be properly explored. At VIAMS, Dr. K.V. Vijayan Institute of Ayurveda Medical Science, we treat and document each of these cases with ultimate aim to invite attention towards Ayurveda possibilities in the treatment of neurological, neurodegenerative, neuropsychological, and neuroparenchymal disorders. Still, I can say, yes, we can control Parkinson's disease.
Thank you, Dr. Vijith, for sharing your knowledge and expertise with us. Now we have reached the Q&A portion of today's session. This is your opportunity to ask questions and engage in discussions with our speaker.
You can please unmute your mic and ask your queries. Screen.
Excuse me.
Yeah, Sanjay ji, namaste.
Namaste. So I wanted to know, I've been diagnosed with Parkinsonism,
Yeah.
and I wanted to know, in terms of, you mentioned that 8 hours of sleep is good, and
Okay.
you also mentioned yoga meditation.
Yes.
If you were to set a priority of what is better and what is not so good, then
Which
what would
one?
it be?
Which one? The medicines or the yoga?
No, the medicines are given, I suppose,
Okay.
and it's the sleep or the yoga meditation, which is more important.
You are asking that the sleep will improve if you done the yoga like that? Is that the question?
No, no, I'm asking whether sleeping is more important or yoga meditation is more important.
No. Sleeping. See, if you don't yoga or if you're not possible to do the yoga or meditation, definitely you have to sleep daily, minimum at least 6 to 8 hours of time. That is most important.
Yeah, so
Whether doing
that's my
yoga or not
problem,
doing
because
that is secondary, but sleep is most important. No doubt about that.
no, my problem is that I am at an age where I wake up in the morning to urinate,
Uh,
typically at 2, 3, 4, that way.
and after that, you are not getting a proper sleep.
Yes.
Okay. So, proper sleep in the sense you're not getting a sleep or even a deep sleep.
No, I'm not getting deep sleep, I
Okay,
suppose.
see, at that time, if you are able to do some yoga or some relaxation techniques, once you wake up to go to your washroom and after coming to the bed, if you can do some relaxation techniques, that will definitely promotes the sleep.
Okay,
Okay,
fine. Thank you.
thank you, Sanjay ji. Take care. Patmaja has been raised the hand. Madam, please unmute and ask. Please unmute your mic and ask.
Okay.
Yeah.
Yeah. What do you want to ask?
You remember me? ഓർമ്മയുണ്ടോ ഈ മുഖം?
Ormayunde sir, how are you?
He's not become any better.
Okay.
Vijith. He's getting, in fact, he's losing his memory also.
Oh, okay. It started the medicines for the last 1 month, right?
നമ്മള് പാർക്കിൻസൺസ് മെഡിസിൻ എടുത്തിട്ടില്ല ഫ്രം യു.
Okay, you didn't take. Okay, we take only one consultation on you. Didn't start the medicines.
ഇല്ല, we only started the allopathic, that's Indopa.
Okay. See, you can try Ayurveda for at least 1 or 2 months of time. Nothing wrong in that.
Okay, and can we stop the other medicine?
Allopathic? No, not initially. Initially, you have to continue with the allopathic and Ayurvedic medications. And during the second or third consultation, I will let you know how to taper the dosage of the allopathic medicines. The thing is, it is not possible to stop the allopathic. See, I'm not talking the negative with the allopathic medicines. It is not possible to stop the allopathic medicines immediately. But if you start the Ayurvedic medicines after 1 or 2 months of time, or after 1 or 2 weeks of time, a fine day morning, you're deciding that I'm not taking Ayurvedic medicine, you can stop it. Nothing will happen.
Okay.
But allopathy is not like that. You have to take allopathic and Ayurvedic medicines in the same direction, and I will advise you how to taper the dosage or even you can taper the dosage according to your improvisation. That's
Okay,
it.
Okay, doctor. And doctor, suppose he wants to come for this treatment in your Palakkad hospital, and the
See, generally the procedure what I'm doing is I will take an initial consultation. If the patient is ready to take the medicine, I will send the medicines to courier for 1 or 2 months of time. And by the third month, we will advise to come and admit in our hospital. And generally, the sessions will be minimum of 21 days. Sometimes it may be extended up to 28 days regarding the... See, now you mentioned that now his memory is also getting deteriorated. So we will rather focus on the rehab mode rather than a vigorous treatment mode. So rehab will take more time. Okay. So it depends each and every patient.
Can I speak to you now?
Yeah.
Doctor, I just go back to my history.
Yeah.
It's very difficult to doctor like you to remember.
Okay.
So 2 years back, what I have done it. I undergone a major operation,
Now.
gastroenterology.
Okay, fine.
I had a tumor weighing 6 kg. Has been removed from my body.
Okay.
This was first week of April 2021.
That is 3 years before.
3 years before.
Okay.
Then the corrective surgery also done it.
Okay.
Because they put the blood should go out, so they put a bag here. And we have to clean that one. That's all gone now. 3 years back, it is removed also.
Okay. So I'll do one thing. I will go through all your medical reports and I will tell you an expert opinion how to start the treatment and how to do the Panchakarma treatment. That will be better.
That's one thing.
Yeah.
Doctor, is that what my wife says that I lose memory.
Okay.
Absolutely, what my childhood, my this thing, perfectly all right, no problem.
But you may be suffering with your recent memories, short-time memory loss.
And if I am talking to you, first, how are you, doctor? I stop it and I forgot how are you, doctor? That sentence I forgot.
Okay.
Then to connect you, this it takes time. That is there.
Okay.
അതുകൊണ്ട് കുഴപ്പമൊന്നുമില്ല, but still uncomfortable when speaking.
No problem. We will go through it, sir. I think you had shared your contact details with my healthcare advisor. So we'll contact you soon and we will go for a permanent solution. No worries. Take care.
Thank you. Thank you, doctor. Thank you.
Yeah, okay.
You have to give me some time today.
Yeah.
Because I have fallen down at least 15-20 times.
Okay.
So grace of God, no bone injury, nothing.
Okay.
So,
sir, it's a humble request because some more patients are raising the hand. So these things we will discuss in person.
okay.
Okay, that definitely I will arrange a call back within 1 or 2 days of time. No worries.
To Bangalore now?
Sorry?
You will be coming to Bangalore?
Not plans yet, but I will let you know. If I'm coming, I can come and meet you. No problem.
Yeah.
Thank you, doctor. Thank you.
Thank you very much. Take care. And Hari Chalana Sani Hari Babu has raised a hand. Please unmute, sir.
Unmute.
Sir, please unmute. In your screen, there will be 3 icons, and in the middle, there will be a mic icon. Yeah. In the screen, there is a mic with a tick one. Just click on that mic. We can do from here. You have to do. Okay. So leave your contact number in the chat box, sir. So we will contact you. No worries. Maya Jaki, can you please unmute and tell?
ഹായ് ഡോക്ടർ.
Hello, how are you?
ഞാനിവിടെ കോഴിക്കോട് നിന്നാണ് വിളിക്കുന്നത്. എൻ്റെ ഹസ്ബൻഡിന് വേണ്ടിയിട്ടാണ്.
Okay.
69 വയസ്സായി. പാർക്കിൻസൺസ് ഒരു 2014 ഓൺവേർഡ്സ് ഉണ്ട്.
2014. അപ്പോൾ 10 വർഷം.
10 വർഷം ഓൾമോസ്റ്റ്. സ്റ്റാർട്ടിങ് 14ലാണ്, പിന്നെ കൺഫേം ചെയ്ത് 2016.
ഓക്കെ.
പുള്ളി ഒരു ഡോക്ടറാണ്. സിൻഡോപ്പയും പാസറ്റൈനൊക്കെ ആയിരുന്നു എടുത്തുകൊണ്ടിരുന്നത്. പിന്നീട് അത് നിർത്തി വളരെ കുറഞ്ഞ മരുന്ന് ഡോസേജ് എടുത്തിട്ടുണ്ടായിരുന്നുള്ളൂ. 110 പകുതി വെച്ചിട്ട് എടുത്തിരുന്നുള്ളൂ. അത് കഴിഞ്ഞ് ഞങ്ങൾ മൂവാറ്റുപുഴ ഒരു ആയുർവേദ ട്രീറ്റ്മെന്റിൽ പങ്കെടുത്തിരുന്നു. പഞ്ചകർമ്മ തന്നെയായിരുന്നു ചെയ്തിരുന്നത്. പക്ഷെ ആ പുള്ളി ഇപ്പം ബെഡ് റിഡൻ ആണ്.
Okay, madam, no worries. Do one thing. Send me all the medical in the screen. You may be seeing our contact number and contact details and the address and everything. So just send all available reports to that number, to that WhatsApp number. Within 1 or 2 days of time, we will take a personal consultation, and I will help you like the maximum what we can do in this case.
Okay. Okay.
No. Okay. So,
sir, I am Haribabu, sir.
Yeah, Haribabu. Yeah, tell me.
I can speak little bit English, sir. I am Haribabu from Vijayan, Andhra Pradesh, sir.
Okay. Tell me.
And my friend's son have demyelinating problems, sir, in brain.
Okay.
Is treatment in your hospital, sir?
Okay.
Demyelinating problem, sir.
Okay. Yeah. If you can get the medical reports, like what it will be like. There are so many demyelinating diseases, like Wilson's disease is there. So many demyelinating diseases are there. Okay. So if I can see the reports, definitely I can help you. No problem.
Is treatment in your hospital, sir?
Yeah, our hospital is situated in Kerala, in Palakkad district, and we will do online consultations, and we can send the medicines to courier also.
Okay, no treatment, sir, only medicine.
No, medicines and treatments are available. Initially, we will ask the patient to take the medicines, and after taking the medicine, some symptoms will improve. The patient is advised to admit the hospital.
Okay, sir. His age is 20, sir.
20 only. So definitely there are chances. Kindly contact us on this number in the screen. It's 7034992442. That is the contact number. So if you can send the details and everything, I can help you. No problem.
Okay, thank you, sir.
And there is the chat box, Parkinson, Ligos, Dragia. Can genetic Parkinson be helped reverse? Not only genetic Parkinson, any Parkinson disease cannot be completely reversed, but we can control the signs and symptoms, and we can stop the progression of the disease.
Oh, okay, sir.
Thank you, Captain Shiju Thomas, for your kind words. And open the queue. Deshpande sir.
Can you hear me?
Yes, you can. How are
Okay,
you?
how are you? Thank you for the session. Very useful information.
Thank you.
Just wanted to ask you one question. So you mentioned in your talk today that you in your hospital you typically do 2 months of initial treatment and then you evaluate for the third month, right? So I completed 2 months
Yeah.
since I met you, and then
No,
I asked
you had
them.
already done the Panchakarma also.
Okay,
You had already gone to the Panchakarma treatments, and
correct.
I think yesterday or day before yesterday, 2 months of medication has been shipped to you, to US.
So yeah, so is it every 2 months I should renew the medication, or is it
No,
mostly?
every month you have to take a review consult. You can purchase the medicine for 2 months of time, but
Okay.
now you may be aware that I had changed the dosage from 15 ml 2 times to 10 ml 3 times a day, and the capsules has been rearranged. So that rearrangement has been done just because of the inputs from your side.
Right.
So I'll be prescribing the medicine and giving the medicines dosage according to the patient input.
Okay.
Okay, so
Okay.
that's why it's most important that you have to take a review consultation or online consultations once in a month. You can purchase it for 2 months, no
Yeah,
doubt. No problem.
yeah. That was my question.
Yes.
Okay, and so you want the capsules to be taken twice, 3 times, two capsules each, is it?
2 capsules 3 times a day. Yes.
Okay.
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 Thank you, sir. Take care.
Okay.
Screen. Okay. Anybody else?
Captain Shiju Thomas, what is the role of fasting in managing?
What is the role of Captain Shiju Thomas? Are you there? Can you please? What is the role of fasting in managing Parkinson's disease? It is not advisable to take fasting or severe diet plans, because it is a degenerative disorder and the progressive degenerative disorder affecting the muscles and the nerves. So in Ayurveda, patya is most important. Patya means taking the medicines and food in the right time and the right quantity. But I will never advise any Parkinson's disease patient to take a fasting or take a diet plan. Diet plan in the sense, definitely diet plan will be there, but to cut down the food or the medicine, because it will deteriorate further.
Hi, sir.
Yes.
Hanvika's father here.
Yeah. How about Hanvika? How is she doing?
She is doing very much fine now.
Okay.
So much improvement actually.
Okay. Thank
So,
you.
what happened now? Actually, my father is means he told to ask you. So, you said we should have minimum 6 months of gap, right?
Yeah, for the next session of the treatment, you had completed only the treatment the last month, so minimum 6 months is needed for the next session.
Yeah. So, is it okay that we directly come on in? Can we come in the 7th month? Because due to the improvement, improvement is so much. There is a drastic change actually in
Oh,
the
that's
improvement.
great.
So now, she is. The body has been very much. Everything is now loose, and she is so much. I mean, flexible now.
Okay.
So my father is means very much happy, and he is actually saying if means if we can do that, means the treatment as soon as possible. So like I said, we need to wait at least for 6 months.
Yeah.
Okay,
See,
so
no worries. We will be taking monthly consultations, so I will let you know. No worries about that.
so we were insisting to repeat the treatment. So can we come on the 7th month? Means,
Yeah, you can come on the 7th month. No worries.
okay, so because my father is means instead we should not wait for 8 or 10 months
And
since the
yeah,
improvement is.
it is advisable because she is on the growing stage, so we can do it 6 months in 6 to 8 months of time. No problem.
No problem. Okay, and the second thing is that here the as you said, the allopathy, the English medicine we need to continue, right? And
Yes. That I will let you know in the coming month.
okay, and the thing is here doctor said we need to perform the MRI of the whole spine. I mean whole screen. I mean, the
When you had done it earlier, like last September, you had done it.
yeah, last year, I think in 2022 we have done.
Yeah,
So
22 September.
so he said like you need to get it done again in this year during in the month of July or August. So will there be any effect due to
No,
this
no. If they insist for an MRI, you can go for the MRI and we can feel the changes.
Okay, but they don't know about the this treatment, the Kerala treatment which I'm
It's all
taking.
right. Either you can mention about that or you can you can disclose that. That is not a problem. Whether they agree or not, that is a second thing. We want the improvisations of our baby. That's our primary thing.
Because I have not informed them, no? So that's why I'm asking you, because so there will be no effect in the scan, right?
No,
Because
no,
the
no,
effect
no,
scan
no,
means
no, no,
not the
no,
body.
no,
Body will not affect, right?
Hey,
Due
no,
to this.
no effect will be there. You can go.
Okay, sure,
Okay.
sure. Yeah. Okay. Thank you so much. Yeah.
Thank you.
Okay.
Okay, as we come to the end of today's webinar, I would like to express my gratitude to all of you for your participation throughout the session. We look forward to your continued support and participation in our future endeavors. I would like to extend our sincere thanks to our esteemed speaker, Dr. Vijith, for sharing his expertise and insights with us today. He is the backbone of our institution and the guiding force for every step forward. I would also like to express our gratitude to the organizing team and all the behind the scenes personnel who have worked hard to make this webinar a success. Once again, thanks to all who were directly or indirectly helped to make the webinar successful. We look forward to future opportunities to connect and learn together. Sarve Sandhu Niramaya. Let all be healthy. Good night.
Good night. Thank you, doctor.
Thank you, and good night. Take care.